Today on the show, the second episode of our international series. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today, we're joined by an expert to discuss cancer care delivery in Puerto Rico. Our guest was on ACCC's very first global panel discussion at the 41st National Oncology Conference held this past October. Dr. Marcia Cruz-Correa joins us from Pan Oncology.
One of the aspects that is very different between, Puerto Rico and mainland USA is that the physicians are all, or most of them are in solo practices. So you see one or two physicians and they all have different contracts with the different health insurance. So, the practice, which is, I would say 90% of all patients with cancer are seen by the community physician, not at the academic center, right? Which is where I am most of my time.
What are some advancements that you're keeping an eye on?
So I'm very excited about early detection and cancer prevention, both things. In the early detection field, for years we were thinking about where is this great blood test that will be similar to, getting a blood sugar, right? Or the cholesterol level. And then we can give you a pill and prevent, heart disease. But we didn't have that for cancer. Now we have it. It's detecting cancer before you can have any symptoms, before maybe even a test, like an imaging test. So I think that's the future. I think the future is already here. Now we have to see how really good it is, right? In perspective, in randomized clinical trials. The other, aspect that I'm very excited is that, I'm starting to see for the first time in my life, and I've been doing, I've been a physician scientist for the last 25 years. So I am starting to see people that have stage 4 cancer that get cured. And I never thought that we were going to be able to see that. Colorectal cancer patients, when I was in training, if they came with advanced stage 4, the life expectancy was extremely low, less than 1 year. I used to lose patients very quickly, very frequently. Nowadays, immunotherapy, targeted therapy, antibody drug conjugates, all those agents have really transformed the way that we treat patients. And I'm seeing patients, that basically go from having stage 4 cancer to have complete response without surgery.
Tell us about the community engagement and prevention work you do.
Oh, yes, absolutely. So when I moved back to Puerto Rico, I train in mainland USA, but I'm from the island. I said I have to go back, It was really impressive that, colorectal cancer was really the number one killer. And we all know that prevention is the key for colorectal cancer. But the uptake for colorectal cancer screening in Puerto Rico was about 30%. So 3 out of every 10 adults were doing what they needed to do. The other 7 were not doing it. And the most common reason for that was because there was lack of education. There was also lack of health insurance coverage. There was limited opportunities for patients to, find the right doctor at the right time. So, I realized that, a physician with a white coat preaching, to the community was not going to make it. You need to create, stakeholders, community advisory groups. So we decided to create a coalition. So we created the first colorectal cancer coalition in Puerto Rico back in 2012. We wanted to prevent cancer or detect it early because at the end, what we want to prevent is losing someone to colorectal cancer. So to make the long story short, we went from 3 out of 10 people to 8 out of 10 people. So now, in Puerto Rico, when you look at the data, about 78 to 80% of all Puerto Ricans that should undergo, some sort of colorectal cancer screening, they do it. So, this was 10, 12 years, and we were able to change a behavior.
You've done a lot of work to increase clinical trial diversity in Puerto Rico. Tell us more about that.
Less than 5% of every patient in the USA participates in a clinical trial. So the sad part of the story is that less than 5% of that 5% of people are diverse population. And that's a huge disadvantage for multiple reasons. Of course, the right reason is always that, we should be inclusive. But even if we decided that, we don't want to do it for the right reason, let's do it then for the biological reasons. Why? Because if you don't include the patients that will eventually be taking the drugs that are being developed by pharmaceutical companies, then how do you know it's going to work for them? So we created the organization called Pan-Oncology Trials as a community-based clinical trial network. We work with local doctors, local medical oncologists, local radiation doctors, nurses, and the rest of the team, laboratories, to really educate them. And in this short amount of time, we were from 13 clinical trials that we had open in the island back in 2018. Last time I checked was about 2 months ago. And, overall clinical trials open and recruiting in the USA, it was about 5,000 again. In Puerto Rico, we had 203, which is simply extraordinary.
Thank you, Dr. Cruz-Correa. In the upcoming weeks, we'll be sharing more global insights on this channel. Make sure to subscribe so you don't miss out. Thank you for listening. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.